Where do I even go? I think I have pregnancy problems. I want to be seen by somebody, but some people tell me to go to the ER. Other people are telling me to go to the labor and delivery department. I don't even know where to go. Welcome to Heart of Birth. I am Maria Mayer. I am a Christian labor and delivery nurse, and I have a desire to speak to my patients before they get to the hospital so that they can be extra prepared at the heart, the core aspects that you need to know before your hospital delivery. And the first thing you probably need to know is, where do I even go? And it's a really good question because the hospitals all the time will send patients from labor and delivery to the ER, from the ER to labor and delivery. So if we are sending patients back and forth, how do we expect you to know where to go? All in all, for whatever pregnancy complaint you have, if you are 20 weeks or greater, it is reasonable to present yourself to the labor and delivery department to be seen by obstetrics. So a lot of labor and delivery places have different names. So some people might call themselves OBED. So that means like emergency department for obstetrics. So that means anything related to your pregnancy, if you're 20 weeks or over, nausea, vomiting, bleeding, not feeling your baby move, wanting to know if you're in labor because you're having contractions. All of these are reasons why you would want to be checked out by a physician or a care team, and you will first go to triage. Triage is located in the stop 1 of labor and delivery. That is the first time you will meet a nurse. And whether they call themselves the OBED or whether they just say go to labor and delivery, or whether they say you're going to go to the birthing center, all of these can be terms for the exact same thing. And what they're telling you to do is go straight to where we do moms and babies, small tiny stethoscopes. You're going to come in and you're going to meet your first nurse. Basically, we're going to have you sign in. We're going to ask you your allergies. You're going to get an allergy band. You're going to get assigned a nurse, and you will do the standard care for all of your appointments. You will do a standard urinalysis, and then we will sit you down, take a regular round of vitals, and we will put your baby on the monitor and go ahead and talk to you about your signs and symptoms, what brought you in today, the reason for your coming. And then what the labor nurse is going to do is also at that point usually do a suicide screen, make sure that you feel safe at home. And then they're going to ask you if you have any substances on board, anything we would need to know on behalf of the baby. That's your alcohol, tobacco, marijuana, anything like that. Or furthermore. And those are all the things that we do to get at kind of a baseline of your care, or what we call a baseline for your care. And we couple that with, if you have electronic medical records, we look back at that and see what your prenatal visits have looked like. If you're trending towards a medical diagnosis or a medical problem, like that will be taken into account with your chief complaint. What brought you there? You were at home, something happened, and you're like, I need to be seen. This can't wait till my next regular appointment. I feel like I need to be seen by somebody now. And if you're 20 weeks or more, it's 100% appropriate for you to go to the labor and delivery unit and get checked out in your triage. Now, I just want to tell you the purpose for triage. This is not usually where a whole lot of pain meds are given. The purpose for triage is simply to determine whether or not you have a medical condition that warrants you to be admitted to the hospital. So the most obvious of those would be active labor. So I'm having contractions. I don't know if I'm in labor. I'm going to come to the hospital. They're going to check me out. And then I'm going to find out if I'm being admitted. So that's the most common reason for an admission in the labor and delivery unit, but there are also many others. There's medical conditions that can warrant an admission to labor and delivery. If you are preterm or early and you're having contractions, you can come to the labor and delivery unit, and we definitely want to see if those contractions are leading to cervical change or cervical dilation. And that could be a reason for your admission to the hospital. So there's actually a lot of different reasons. Even if you have a viral illness, it's nice to come to labor and delivery because we have certain means of treating that so you can get the best care for you and your baby. And of course, we have your baby on the monitor usually the whole time while you're in triage. So that is stop 1 of the hospital. There is a predictable sequence of hospital care. Triage is stop number 1. Usually there's a doctor assigned to triage for that night. It could be like a shared call group, whereas if you're going in the middle of the night, one doctor might be taking call for other physicians in their group. So the nurse might be communicating with them via phone and will kind of report your care. They'll report what your vitals are, what your urinalysis shows, what the baby looks like on the monitor, if you're having contractions, any lab reports that are necessary, all that gets reported. And then the decision is made whether or not you need intervention or whether you need to go home, or whether you need hospital care or nursing care, which would require you to be admitted to the hospital. Other hospitals have doctors on site at all times, and they would come and see you in the OBD or the obstetrical triage. And again, they're going to look at your baby on the monitor and your basic findings, like what you're presenting with, and then they'll make a conclusion based on what they see, how your story is unfolding, whether or not you need to stay with us in the hospital, or whether it's something we can treat and send you home, whether or not your pregnancy is safe. All of those determinations are made in triage. If you are admitted to the hospital, you move to the next phase of care. But while you're in triage, you will notice it runs much like an ER. There will be other patients. There will be one room, usually bays just separated by curtains. You can usually hear all the conversations that are going on. If there are women having contractions, she might be sitting next to you. You might be there because you have excessive nausea and vomiting and you need to be treated. There's a lot of different reasons why people go there, so you can expect it to be like an ER scenario when you get to triage. Some hospitals are small, and you might just be like the next person that comes in and they have open beds and you don't have to wait at all and you just get seen right away. Other hospitals that are very large might have a triage system where they literally will ask you what your complaint is, what you're experiencing. They'll see how far along you are in your pregnancy, and then they kind of assign you an acuity, like who needs to be seen first. And of course, they'll take the most acute patient first, much like an ER. If you have a broken finger, you're going to wait longer than the person who's coming in with shortness of breath, right? So I'm just saying that the pregnancy sort of triage works in the exact same way. So you might be sitting there for a while. Usually triages can go up to a couple of hours to actually determine if you are an admission to the hospital or not. When we're talking about the most obvious means of labor and delivery admission, it would be active labor. And I will tell you the definition of active labor is cervical change over time. So usually people will check your cervix, find out how dilated you are, and then they'll give you time. So the provider might have you walk around the unit. They might have you just sort of wait there. They might have you give it time, and then they'll recheck your cervix. And usually if the cervix is more dilated or thinned out or showing signs of labor, then they'll admit you to the hospital. But that is an obvious means. There are some people that are pregnant, they might have their third or fourth pregnancy. And in that case, it's very common for people to be walking around towards the end of their pregnancy already somewhat dilated. So the initial dilation, or whatever number you get assigned for how dilated you are, doesn't necessarily mean you're admitted to the hospital. We do look at different factors. So like, how strong are your contractions? How close are they? Are we expecting cervical dilation with that pattern of contraction that we're seeing? So there's a lot of evaluation, but honestly, it happens over time. So usually triage, sometimes it can be straightforward in a quick trip, and other times you can plan on being there for a while, and that would be a normal course of care. So I hope this has been helpful to you. Step 1 of going to the hospital, what to expect when you're expecting, nurse style, hospital style. You should know something about the setting in which you're giving birth. So everybody comes through triage. Everybody is triaged one way or another. And now you know what to expect. Hope this was helpful.